Hi everybody, it's Dr. Michele Drake at the Drake Center. I'm here with Nicole, my trusty assistant, and Moki, my also big helper. And we're here to answer some questions that I think you guys have about dog cancers.
Dr. Drake, what happens after a dog is diagnosed with cancer?
Yeah, so once we get a diagnosis, and it can take a few visits to get a specific diagnosis. The purpose for knowing exactly what type of cancer it is because we have a better idea of how we're going to treat and what the prognosis is. Here at the Drake Center, we do a fair amount of surgeries that, to remove cancers. We also work closely with our local specialists who are oncologists and radiation oncologists. For clients who choose to go those routes, we're going to partner with them and with the owner to make sure we have all the best information for you and then for you to make a decision as to what's best for your dog.
Have there been advancements in the treatment of dog cancer?
Yes, for sure there has. We now have even some injectable chemotherapeutic agents that we did not have before, and specifically in treating mast cell disease. We learn more every day. So I would say that maybe we're not quite as advanced as human medicine in treating cancers, but we're pretty advanced on our information that we have and our abilities to provide longer lives for dogs that are high quality.
What is the cure rate of dogs with cancer?
Cure rate? I don't know the cure rate specifically, honestly. There are some cancers that we can cure as soon as we surgically remove them. There are some dogs that we can put in remission, and then we find the remission just keeps going on and on, like lymphomas. And there are some dogs that, we can buy them a quality 1 to 2 years. And for many owners, it's worthwhile to go ahead and treat that. So the cure rate, I don't know that I have a number for you for that, but there are many dogs that we truly are able to help have a high quality life for a longer period of time. And that's what we're here for.
Is surgery an option for dogs with cancer?
Oh, for sure. We do lots of cancer surgeries, removing tumors, and that sometimes in and of itself can be curative, although they can be kind of a big surgery. They can be completely curative. Or we do surgical cancer surgery, and then may refer for additional things like radiation or oncology, just depending on what the owner's wishes are.
How does a veterinarian know what kind of cancer my dog has?
So depending on the location of the cancer, and so let's say I found a lump on your dog or your cat, I'm going to either do a punch biopsy or a needle biopsy to hopefully get cells that tell me what type of cancer it is, and depending on what the diagnosis is from a pathologist is going to help me to determine what the next plan is going to be. So also x-rays we're going to take quite often to check the chest and look for mets, look in the abdomen, make sure there's nothing going on there in addition. So it really depends on the cancer. They all have a little bit different behavior. If we find lymph nodes are large, we're going to see if this is lymphoma, and then we're going to look for where that is and what type of lymphoma to determine what type of chemotherapies we're going to recommend. So it really depends on the type of cancer, what the general behavior of that cancer is, whether it's one that metastasizes or it's just a localized cancer, and then just go from there.
Okay, last question. Is a dog cancer diagnosis a death sentence?
Absolutely not. We see cancers and cure them, or at least treat them and put them in remission all the time. And we're here just to help guide the clients to give them the best information and work with them to get the best prognosis for their dog. So if you guys have any more questions, thanks so much for listening today, and give us a call at the Drake Center.